Well, everybody's there, and welcome everybody to this week's webinar. Can everybody hear me okay? If you can just wave and tell me I can hear you. So again, I'm Bruce Rosenblatt, and I'm welcome you all to this webinar that I've been doing every week. And it's great to see everybody there. And I know I sort of have a little bit of a following, which is exciting. Um, if you all don't know who I'm a senior housing advisor. I have over 30 years experience in senior housing, and I help people with the decision process of selecting a senior living community, which, as you can imagine, is not an easy process. And so I help people through that process by understanding all the different options in this area. It's kind of amazing, but there are about 100 different senior living communities, both in Collier and Lee County. And so having my inside knowledge about each and every one of them is extremely important. So that's what I do. I have been in this area for about 28 years. And through those 28 years, you meet different people that you find sort of a kindred soul with, and that you feel that you can develop a relationship. And one of those people is Dr. Steve Stohler. So Dr. Steve and I have known each other for many years. We have sweated together, we have laughed together, we probably have cried together, maybe shed blood together.
Yeah.
We are good friends, and I've always enjoyed listening to Dr. Steve because I think he always has some wisdom to share, which is always really good for everybody. So I know he's looking forward to today's presentation, and without further ado, I'm going to pass it over to Dr. Steve. And Steve, the show is yours.
Good morning, everybody. How are you today?
Fine.
Good to see you guys. I just wanted to thank Bruce for this opportunity to speak with you guys. I always appreciate the opportunity to share just kind of our message, which is obviously, it's always important, but in this day and age, it's even more important. Just a little bit about myself. I've been a chiropractor. My original training is chiropractic, but my undergraduate education is in health education. So I am always interested in helping people be healthy. Last week, I had someone say to me, they asked me, they said, Steve, are you a biohacker? And I said, wow, that's the nicest thing anybody's ever said to me, and that, although that may seem strange, it's like, yes, I try to work with people's habits and rituals that they do to just be the best form of themselves. And so that's what we do. Whenever I do any kind of training, I'm a little bit new to this Zoom thing, so you might have to bear with me. I'm much more of an in-person kind of person. So it's a little bit difficult talking to a screen, but I know you're out there, so I will do my best to give the same message to you that I would if we were in person. Again, it's super great to be here, and I really value what Bruce does, because he's helped several of my clients find places where they can be safe and continue their lives in quality and safety and enjoyment. And that's all important, not just for themselves, but also I know for their family members. A little bit about myself. Again, I only have really two rules when I do a speaking engagement. And the first rule is obviously don't believe a thing I say. And why would I say that? That seems a little strange, but the reason why I say this just comes from my experience and expertise. If you hear something today that resonates with you and you think it has value, then, then take it in and utilize it. And if I say something that you might not agree with, that's okay too. You don't have to apply everything that I say or do. I certainly have spent the last probably 15 years studying health and wellness and well-being types of opportunities to just not only improve my own health, but improve the health of my patients. Our chiropractic practice is a little bit different in the sense of we're really more health educators and wellness educators. So we know people want to be healthy. Sometimes they just don't know how to do it, or they need a place to do it. And so that's what we really do, is try to help people through the process of getting healthy. They don't know where to start. And so that's what we do. So if it's okay with you, Bruce, I'm going to go ahead and share my screen, and I have some slides and some videos to kind of start the talking points. The second, of course, I said is that the second rule I have is I'm only going to speak for about 25 or 30 minutes, and I'm going to save some time at the end, but feel free to ask questions during this. I mean, this presentation is not a speech. It's just an opportunity to share with you. So if you have any questions or any comments, feel free to put them in or save it till the end, whatever better for you. Okay?
Sounds good.
All right. So I'm going to share my screen, and then away we'll go. So again, this is us, Fundamental Health Solutions. The puzzle piece in the middle is intentional.
You haven't shared yet.
Yeah. Oh, okay. Sorry. See if I can get back to that. Yeah.
Down at the bottom, there's a little.
Yeah, I got it. All right, there we go. And let's see if we got it now. How about that?
Perfect.
All right. So as you see, this is our logo, and the puzzle piece is there intentionally. We try to help people put the pieces together to have what habits do they need to change or modify to have better health. And as like today's topic is better habits, better health, and a better life. But because of, we know that when we have better habits, we definitely have better health. And if we have better health, as I'll show you later, some statistics that show better health definitely leads to better life, especially when it comes to well-being. Again, I thank you for being here today. It's always a pleasure to speak with people that are interested in improving their health and well-being. It's such a privilege. And my wife, who's also on the line here, Dr. Julie, she's my partner in life and in this business. And of course, I can't do anything without her. She makes all this thing happen. And if you ever try to connect with us in some way, you'll always come through her smiling face at the front door or on the phone. And she makes this office a much pleasurable experience. So again, thank you for being here. And of course, thank you to my wife for facilitating the outside part of this and helping me with some of the slides and things. The question that I want to ask you is, in the future, will people enjoy a compression of morbidity, living both longer lives with fewer years and poor health? Or will those extra years be spent paying the price of unhealthy lifestyles and poor health due to chronic disease, diabetes, and other chronic conditions? And I would say to you, the answer is, it depends. And what does it depend on? It depends on really a couple things. Your habits is probably the most important thing, but also it's a little bit overused, but your zip code plays a huge influence in your overall health and well-being. I want to start off by showing you this little video to prove the point to a certain degree. This is by a video out of Canada, and then I'll explain it to you. So here's the video. Just watch for a second. It's just 1 minute long.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment?
Steve, you want to turn up the volume?
More volume?
Yeah.
It's time to decide. The average Canadian will spend their last 10 years in sickness. Change your future at makehealthlast.ca.
So that video highlights, from Canada, highlights a 12-year they talk about that 10-year, what your last 10 years will look like. That's the message that I often give to my clients. You know, I'm not even really as concerned in the day-to-day, your moment right now, but where you're going to be 10 years from now. And, you know, or especially even the last 10 years, because the decisions you make today have such a huge influence on what those last years like. And I think if we go back to that first question, people would say, wow, you can really see the decisions that we've made and how they're affecting our future. I come out of this, there was a book that changed my life many years ago that I read, and it not only changed my life, but it changed the direction of the practice. And I think it's changed quite a few people's lives that have come through this office. And that was the Blue Zones book. I don't know if many of you have read the Blue Zones book by Dan Buettner, but this book is where they studied the people that lived the longest and were the healthiest in the world. Many of these people were centenarians, so they lived well into their hundreds, and they lived independently. So when he studied these people all around the world, he found that they had these 9 common things in common, this power 9, and this is the message of the Blue Zones. We just happen to be lucky enough that we live in a city that actually has created a Blue Zones project, where as a community, we're striving to raise the health and well-being as a community. And we've been really successful. For the last 3 years, Naples has been the #1 city in the country for well-being, as proved by the Gallup poll. The one thing that you see the quote at the top of this is that, you know, of course, we have huge complex problems, whether it's COVID-19, cancer, diabetes, obesity. And so the temptation is to think that we really need these super complex, intricate solutions, but that's not always the case. The Blue Zones shows that these 9 common little habits done over a lifetime can make huge, significant changes in the outcome that we get. And so in many ways, our habits determine much more about our health than, you know, even what the doctor does for you or how fancy the hospital is, those kind of things. We have much more influence than what we might like to realize. I've been involved with the Blue Zone since it started. You'll see these 9 characteristics here. The reason why I like the Blue Zone so much and the Blue Zones project so much is that it's not really a fad. You know, it's not like somebody collected these things. This whole process was reverse engineered. So they went and they studied the people that were already successful, and they found out what habits they had in common. And they found that they have these 9 simple habits that whether you're in Costa Rica or Ikaria, Greece, or, you know, you're in Loma Linda, California, or Okinawa in the Far East, these are the things that they have. They may be a little bit different with their foods. They may be a little different with their prayers. They, you know, may get together in a little bit different way. They may not exercise on a treadmill. They may be working in their garden or taking long walks to shepherd their sheep, you know, but these kind of habits stay in place. And that's the message there. And the interesting thing about it is it's so much of a mind, body, and spirit connection. And so if you look at these, the #1 habit that you can have is belonging to a faith-based institution. That will get you about 8 to 14 years. And the second most powerful influencer on your life is having a purpose. And that's #2. And that gets you about 8 years. Belonging to a healthy family and having those kind of connections gets you about 4 or 5 years. You know, your social connections and how socially isolated you are is probably one of the biggest contributors as well to those things. And then eating and moving, of course, add to the quality of life, but not always as much to the quantity of the life. So that's where I come from. I come from reading the book, breaking the little things down and trying to, you know, create practices that people can do in the industrial world, because most people don't really want to move to Sardinia and become a shepherd. and they don't really want to live in the mountains of Costa Rica. They like Naples, or they like where they live. And so that's where that really comes from. We have a problem, right? We have a problem. And the problem is for the last 3 years, life expectancy has fallen in the United States. This is the largest decline, or this is the longest decline since World War I. So it's pretty significant. In the first year that it happened, the academics were just perplexed. They're like, well, we don't really understand why this is happening. And then later on, they did more studies, and they found that what's pulling this down is actually people in the Middle Ages, what they call these diseases of despair, right? They're unhappy, and they're taking their lives and becoming their own lives, and then also suffering under chronic disease. The MacArthur Foundation really set up, I had that on the top of there, they defined what successful aging is. And this is a thing that Bruce and I really have in common, and that we share, is that, we're trying to create a space where people can age healthily with limited disease. They can maintain their cognitive function and physical function. They can stay engaged with life. And that's why, based on what we do, I try to keep people in their homes, but when they can't stay anymore, or they need that little extra help, that's one of the things that I really value that Bruce does, is that he, assesses the person's needs, and he finds the right place for them so they can continue to age successfully, and without really losing the quality of life. We know that, life there is a termination point, but we want to try to enjoy it as much as possible. And those are some of the common ground things that Bruce and I have in common. So you'll see that this life expectancy has fallen. And while the video that we showed earlier said that Canada, has 10 years, those last 10 years, many people will not enjoy the quality they have. In the United States, based on the Blue Zone studies, we're leaving about 12 to 16 good years on the table. And I think that's an important thing to think about leaving those 12 to 16 years. That's a long time to be unhappy and unwell. And so I want to break down this life expectancy because, a lot of people can't really see what that looks like. And I don't even think that's the greatest term to measure. I think the better term to measure is not just longevity, but health span. We also know that in the United States that chronic disease is rampant. 4 in 10 individuals in the United States have 2 chronic diseases. 6 in 10 individuals have 1 chronic disease. I don't know about you, but having any chronic disease is not something that I'm looking forward to. That's not something that I want to engage in. And it's a huge cost, not only to the individual, as I'll show you later in some of the slides, but also to our country. It's not just a matter of a health expense. It's kind of a national security crisis, not just a health crisis that we're in. So this is the concept that I want to really focus in on this slide here, is that longevity, the number of years, can really be broken down into health span and this disability zone. So if you follow this graphic a little bit, you'll see that those people that have that increased health span, which is what we're talking about, actually have about 40,000 better days than the person who doesn't have that health span. So the average, we're all going to die, and that's, that's just a fact. There's death, there's taxes, those are 2 things that just can't be really changed. But the person that has that increased health span is going to only have about 1,000 days or 3 years. And when I talk to some of my friends that build some of these assisted care living centers and independent living centers, they know that their client is about that 3-year period. That's how many years that generally their average client will stay in their care. If they've lived that good health span, that's a great opportunity for people to have that facility if they can't go in with family, or if they want to still live independently. And I'm not sure about you, but you know, I really don't, if I'm 1,000 years, like 1,000 days I could probably put up with, but 5,000 days, you know, is quite a bit longer than I really want to have not feeling well. The problem is that we don't really even track health span. No one even, there's not even a way to, you know, in the mainstream medical community, nobody really even measures that. You know, we measure your cholesterol, we measure maybe your blood pressure, and those are all components of health span, but they're not, no one's really measuring are those things. And there are these biomarkers that we could track earlier in our health careers that if we manage those numbers, we probably would enjoy a lot longer health span than what we are right now. So again, this curve, and I'll show you a different curve later about how that's going to mimic this same kind of discrepancy. So the difference between the shorter line and the longer line really is influenced by our habits. And that's kind of our message for today. We talked about this. This is really what it looks like. The average health span in the United States is about 63 years. Well, if we're now retiring later and later because of the finances of growing older and those kinds of things, that leaves a lot of years on the back end of this where we can really struggle. When you ask people what some of their biggest fears are, it's one, suffering from chronic disease, and or two, having the money to survive those last years. Will they have enough if they actually live that long? And you notice that now the retirement age is way past 63. So that means many of us are just limping in to these golden years. And for those people that haven't put the emphasis on health span, maybe those golden years aren't so golden, you know, or they're golden more towards the medical community rather than enjoyment. Again, a long health span makes a vital, energetic life more possible and can ripple outward, allowing us to just really enjoy our families, our freedom, our independence. And that longer red number that you see in the top graphic actually equals out to that 12 to 16 years. And so what we're really striving for, both at Fundamental Health Solutions and with this message that's also, you know, it goes hand in hand with the Blue Zone message, is this optimal longevity. If this is normal, the top line, and what's optimal, what are the things that are in our control to get away from what's normal in this country to what's optimal? And clearly the United States is falling behind in the industrialized world. We have slipped, and it's been said that if we were to try to catch up to countries like South Korea and Japan, it would take us 100 years at the rate that we're going. I don't know about you, but I don't have 100 years to turn this thing around. You know, in my life, I need to start today. Before the meeting, I was talking to Bruce a little bit, and I was saying, you know, they say the best year to plant a tree was 20 years ago. And the second best year to plant a tree is today, or the second best day to plant a tree is today. I think you could make the same argument for working on your health practices. The best time to start working on your health practices is probably 20 years ago. But the second best day to start working is today. And that would be the message that I would try to bring to you. The other thing is that it's not just about, you know, having a strong health, heart, or, you know, keeping the body weight. You know, our happiness is really important. And although there are multiple factors, I'm just going to show you this one graphic. If you look at the United States, we've fallen in our happiness over the last few years. And one of the biggest determinants of happiness is good health. So those people that have had good health have been, since 1976 to 2018, have stayed pretty steady on their reported happiness when they grade them. You know, how happy are you on a day-to-day basis from, you know, 1 to 3? The average for those people that are staying in good health is about that 2.3 level. But those people that don't enjoy happiness have really fallen, since 1976 to 2018. So again, good health really promotes happiness as well. And that's what we strive for, is that, again, that optimal living, that optimal longevity where we're happy, our days are fulfilled, we have purpose, we can serve and show up and work and serve and enjoy those days. And I think that's a really important message to remember, because nobody wants to live those last 5,000, days miserable. That's not what we planned for, or maybe didn't plan for. The next message I have is it's extremely costly to be unhealthy. So what you can see here is that the top 1% of people that are unhealthy are, that top percent, 21% of our healthcare costs go to that expense. That's about $95,000 per year spent on medical expenses. That's a huge number. $95,000 a year, that is not really sustainable unless you're just a billionaire. And of course, that's where it plays into, it's not just a medical issue, it's a national security issue, because that's money that can't be funded for infrastructure, money that can't be used, to create education, to develop research and technology. That money has to be spent taking care of just people that are not very happy and certainly not very healthy. And if you go to the top 5%, that number is just exponential. But as you spread that out, the average person costs for the top 5%, about $43,000 a year. And then when you get down to the 50% of people that are unhealthy in this world, that expenditure comes out to be about $8,000 a year. And what we find is that we're not really getting a good return on our investment in our current state of medical treatment, because we pay more than any other country in the world, yet we get very poor results. We're like 39th in the world, and we pay more than anybody else, and nobody wants to make that investment, right? So we not only have high risk, poor health, but we pay more for it. So clearly there's something that's wrong in the system that we've got going on. And, these things aren't really changing fast enough for the average person to make the necessary changes to, change the outcome. And why is that happening? It's because, like I said to you before, our habits are the driving factor. So, what makes us healthy? Well, 50% of being healthy is our behaviors, as you can see from the graphic on the left, and 20% is our environment. So again, like our zip code or the state we live in, 20% is our genetics, and then the final 10% is our access to medical care. Unfortunately, we spend 90% of our dollars on access to medical care. So again, that really doesn't have this great return on investment. And so we really should be trying to spend is 90% of our dollars on maximizing our genetics, putting ourselves in a great environment, and then just doing those little things done every day that really make the big outcome. And if we do that, not just as individuals, but as a community, one, we not only make our lives better, we make our families better, we also make our community better, and we may also make the country better, and hopefully the world better. So currently what we're doing right now is spending, a large percentage of our income. So 90% of the money that we spend goes towards these medical services, which really only produce about 12% return on the investment versus what we could get like 80%. Now, I'm not an expert in the stock market, but I would much rather get an 80% return on my investment than or 90% return on my investment than 10%. Again, this takes me back to this blue zone principle, about doing these little things that make such big differences and make life enjoyable. Obviously, nobody wants to be socially isolated. We want to have, strong families. We want to hang out around the right kinds of people. We want to maintain a body weight that allows us the freedom to move around and do things and enjoy life. And that's what the Blue Zones principle talk about. So if you haven't read that book by Dan Buettner or haven't gotten involved with the Blue Zones project, I really encourage you, to get involved with that. And I think that will make a huge difference, in your life. The thing that I also like about the Blue Zone, which came to me when I've been researching this and speaking about it over the years, is this little Power 9, what they call the silver buckshot, is really a recipe for developing resilience, not only in our personal lives and in our family lives, but in the community and the country. And I think, even though we're all experiencing this disaster of this COVID-19 epidemic, a lot of the roots of this are these comorbidities of obesity and unfortunately being, sequestered in, nursing homes. These are the highest, most at risk people there. So obviously trying to stay out and independent is a great place. So this concept of resiliency is just the Blue Zone message. If you haven't read the book, Anti-Fragile by Nassim Taleb, it's not necessarily the best read in the world because it's very technical about a lot of things. But the last half of it really talks about healthcare. And I love the concept of this being anti-fragile. Most people don't even know the word, because it's somewhat of a made up word. But if you have, everybody understands, the concept of fragile, it's kind of like China, right? You bubble wrap it, you protect it. Unfortunately, some of the practices that we've had in our world have made us really fragile. And what we really want to strive for is being the opposite of that, which is anti-fragile. The next graphic that I'll show you, it really demonstrates what this anti-fragile is. So you can see that this curve actually mimics much of that longevity and the health span kind of graphic that I showed you earlier. You see that if we're fragile, yes, we live to a certain age, but then we quickly just kind of fall off. And the space between, when we drop below this independence curve and when we actually die, that bottom line is not really this pleasant living. It's loss of independence, it's unhappiness and despair. And unfortunately, in my generation, we're hitting it much too early based on our habits, whether that's obesity, addictions to drugs and alcohol or smoking, chronic disease, loneliness. And so some people can't bear being below that line and they're taking their own lives at greater and greater levels, so much to the point that it's actually pulling down the whole country's life expectancy. And what we should really strive for is to be robust and or resilient so that we can stay in that curve much longer. And again, we have to be able to, like what we are right now, and resisting some pressures that are on us, or even adapting in a positive way to what's going on in our world and controlling those little things in our own lives that make us adaptable and become better from, whatever's thrown our way. Many of my clients, because we started the year earlier, we start a season every year in our office where we have these get-togethers once a month and we talk about these kinds of habits. It's a shared dish event. I used to say a potluck dinner, but that's not very appetizing. When you say potluck, who wants potluck? But when we started having these shared dish events, people would bring food and we'd share time together in education. And we started last year saying best year ever. And for many of my clients, they've lost more weight. They've had more time to exercise because they've, some of the distractions that might have taken them out of the game, they've been able to focus on those things. Whereas unfortunately for a few people, they've got their quarantine 15 pounds that they've added on because just hanging out at home, not being able to play tennis, not be able to go here or there, not be able to, they've just basically visited the refrigerator way too many times and watched Netflix way too many seasons. And so now they're a little bit behind. So we've been still trying to get that message in, is like, utilize this time, adapt, resist the temptations of doing nothing or just hunkering down, be creative so that you can become robust and or resilient in this time of pandemic and crisis.
Dr. Steele, I have a question for you.
Yes, sir.
So, if somebody's on this call and let's just say somebody's in their mid 70s, mid to late 70s, and they come to you and they say, Dr. Steve, I enjoyed your presentation. What do you do? Can you walk people through what your process would be with that person who maybe needs to develop some new habits or maybe wants to plant that tree today?
Yeah, that's a great question. Thank you, Bruce. Well, when somebody comes in with us, just like in any kind of medical profession, we sit down with them and we have a conversation, right? And the people that have the most success in this office are the people that have in their mind what they want to try to accomplish, right? They say, Steve, I would like to work on this, or in many cases, where do you suggest that I start? And it always starts for me with the macros and the micros, as far as like general health, so we look at macros in the sense of what is your body mass index? So what's your height to weight ratio? Because we know the risk for all disease or heart disease, cardiovascular disease in that sense, diabetes, even Alzheimer's, those kinds of things. It really comes down to obesity is the driver of chronic disease. Of course, the number one thing easy to do is, to give up is smoking, or maybe not so easy, but that's obviously the number one. But number two really comes down to obesity. So we start working with people's macros to help them get to normalize their body weight. And the micros would be kind of those little nutrients that they might be missing, so that we do some testing called a SpectraCell micronutrient testing. So we look and see, is your D adequate? Are you taking the right B vitamins? Do you have enough antioxidants? And we can specifically, through this testing, determine what they specifically need. A lot of people take vitamins, they just don't know if they're doing anything for them. They take a multivitamin, they take this, or frequently they take a lot of the things that are marketed out there, like this is the best thing ever, this is the best thing ever, this is the best thing ever. Yeah, but we just don't know, do you need those things? So a lot of times we'll sit down with that conversation when it comes to those macros and micros, and let's just find out where you're at. Because we know that when you reduce obesity, you really reduce all cause of mortality, right? Whether that's cancer, whether that's stroke, whether that's diabetes, whether that's heart disease. So we really work with that. And then we look at those habits like, movement. Well, I can't move. I have a bad knee. I have a bad hip. I have, a bad back. I can't really exercise. So then as you know, we work with people's individual limitations, and we create programs that they could do on a day-to-day basis to restore themselves. And if you really think about it, 70s is not really that old. I mean, if our goal obviously is to be, like a centenarian, 90 to 100, you still got the 20 years to work on it, right? Unfortunately, when you start later in life, you have to work a little harder, and be a little more consistent than maybe when you're in your 30s, right? You have a little more leeway when you're in your 30s. But again, it's never too late to start doing those things. And I've seen people make changes within 3 months to a year that are significant. People that were previously diabetic are no longer diabetic. People that previously had cardiovascular disease are no longer have cardiovascular disease. People that had poor pulmonary function, and they were, asthmatic or were starting to see these signs of COPD with simple breathing exercises or movement exercises or dietary changes. This all can be reversed. That's the nice thing is like when you saw that graphic about anti-fragile, we were actually designed, to repair ourselves. It's not like, once the damage is done, some of it's not reversible. In many cases, it is reversible. And that's goes back to that first tenet of faith, being the number one thing. Do you believe that tomorrow can be better than today? So for many of my clients, the first thing that comes in is like, what's your mindset? Do you have that faith mindset where that you believe that tomorrow can be better than today, or you do not have maybe that faith and hope that tomorrow can be? And those people that have that faith and hope and then apply discipline to it, they're the ones that are the most successful when they come into it. I mean, it's not easy to change habits, especially if you've been doing something for a long time. It may be difficult to and what happens when anytime you work with people about change or transformation, there's stages to that, right? The first thing is that you didn't even know what you didn't know, right? And then the second stage is, wow, I want that, but it's a lot more difficult than I really ever thought it would be to learn something new. There's a learning curve that takes place. And then you start to, develop those habits, but it's kind of sometimes developing that consistency to stay with it. And then the third, the third or fourth stage is like, now it's easy. I just do it because it just seems natural. I've learned that new habit. Maybe you've heard many times in the past, it takes 28 days to create a new habit. That's probably not true. It probably takes more like 6 months to really ingrain it. A lot of people start off on fire, and they really push it for the first 30 days, but it doesn't seem to really stick into a lifestyle habit until after about 6 months. So that's what we really strive to try to do. And if you see this graphic here, this is what really makes it happen. There's this James Clear is the guy that wrote this book called Atomic Habits. I'm a big reader. I think that, books can change your life and people can change your life. And so for me, several books have changed my life. And for me, several people have influenced me and changed my life. And that's what we strive to do at Fundamental Health Solutions is we strive to create a culture where when you join it, it's actually abnormal to be unhealthy. So you just kind of go, wow, I want to be part of the culture where healthy and happy is, the normal. That's what people just do. They have a positive attitude. They're faithful. They're encouraging. They eat healthy. They don't sabotage each other. It's that, again, that Blue Zone principle of right tribe, so we know that, if you show me you're the average of the 5 people you spend your most time around. So we know that if you hang around with smokers, there's a probably pretty good chance that you're going to take up smoking. And if you hang out with people that are overweight, you're probably going to be overweight yourself. And so we try to apply that same principle that if you're hanging around people that are energized, they're serving, they're eating healthy, they're exercising, you're just going to be pulled along by the power of the pack or the power of the group or the power of that culture. And so that's what we really strive to do is create a culture where, health span is a priority.
Right.
I mean, and for anybody that out there that is interested in like, hey, I'd like to do more, like know more, do more. I mean, here's our contact information. You can go to our website, www.betterhabitsbetterhealth.com, or you can call or email Julie that's my wife, Julie at fitdocs.com, or you can even just give us a call and just say, I'd like to know more about what you do and how you do it. But that really is our mission out there, is to improve people's health spans, improve people's well-being and happiness. And it absolutely works, right? If you change your habits, consistently apply discipline to it, you can change your outcome. And it's, although it may be, difficult at first, it's there, where there's a will, there's a way. Sometimes there's, sometimes it's a mindset thing. And I would say that most things in life are mindset, developing that mindset, and then the rest just really follows.
Well, I remember one of the things that you shared with me is when you go to the grocery store, you walk in the outer aisles versus going down the aisles where there's the cookies and the chips and all that. So kind of walk in the outside aisles of the grocery store. So that's something that I always remember.
Yeah, I think what's happened is, like, if you look at the culture that we've created in this country, there's a difference between pleasure and happiness. See, a lot of people think that pleasure equals happiness, but there's quite a few good books out there. One called by Dr. Lustig, which talks about the hacking of the American mind. We've been encouraged to seek pleasure over happiness, and happiness comes from many times simple things. But pleasure is created around a system of addiction, right? You know, so you want one potato chip, then you want two potato chips, you know, and then an hour later you want some more potato chips or M&Ms or those kinds of things. And have actually stimulated our, you know, pleasure pathways way too much. And so to a certain degree, in seeking pleasure, we've actually created a very fragile society. So, I mean, I'm not for, you know, like pain, you know, you have to just go through pain. You know, I think that once we find out that happiness is actually joyful, and, you know, it doesn't have to do with eating the whole bag of this, that, or the next thing, or it doesn't have to be, you know, put around addiction. You know, I think it's a very fine line. I'm not saying you can't, enjoy a birthday cake or, you know, but do you really need a half a gallon of ice cream every night when you're struggling to, to move in a healthy way every day?
That's good stuff. So, Dr. Steve, I'm going to open this up for everybody. We have a few minutes left, and I'm going to open up for questions. See if people have any thoughts they want to share.
Please. I love talking to people.
So anybody has any questions, everybody's unmuted, so feel free to speak up.
Who's going to be the first one to ask a question? Nobody likes to be the first one, so.
Anyone? Okay. Well, Dr. Steve, thank you very much for being part of this. This is great information, great insight. I learn everything. I learn something new every time I listen to you. So thank you so much. Thank you very much for your time. Julie, thank you very much for helping organize all this. So I really appreciate you all. Keep up the good work. And
thank you, Bruce.
Just so you all know, next week we're doing our webinar will be from Linda Goldfield from the Parkinson's Association. So she'll have a lot of information to share from the Parkinson's group. And then the following week, you get the pleasure of hearing me. So the following week, I'm going to be talking about senior housing and the ins and outs of all the different senior options. So you definitely want to be part of that one. But feel free to reach out to me if you have any senior housing questions. Reach out to Dr. Steve and Julie if you want to learn more about what they do. And hopefully today you will go and plant your tree, because it's not too late to plant your tree.
Yeah, thank you very much, Bruce. It was a great opportunity. I appreciate it.
All right. Take care.
Have a great day.
Bye-bye.
Thank you.
Thank you.
Thank you.